Good evening, this is your host Trevor on another episode of New York Podcast. In this episode, we're going to talk about new changes coming to Medicaid recipients next year. Yes, there is a massive policy shift coming for Medicaid. Following the passage of the Federal Budget Reconciliation Law, often called the One Big Beautiful Bill Act, the federal government issued its official implementation rules on June 1st, 2026. The nationwide rollout is scheduled to officially start on January 1st, 2027, though states are required to start mailing out introductory notifications and setting up their compliance framework as early as September 2026. A breakdown of who this affects, what is required, and who is exempt outlines details of these upcoming changes. The first one. What are the new requirements? If you are subject to new rules, you must complete a document at least 80 hours per month of approved activity to keep your health coverage. You can meet these requirements through paid employment, working at a regular job, income threshold, earning a monthly income equivalent to at least 80 times the federal minimum wage, which amounts to $580 per month, education, being enrolled at least half-time in an undergraduate, graduate, or trade school program, job training, participating in state-approved vocational training or workforce programs, community service, volunteering, or participating in community engagement. Combinations: you can mix and match these activities, e.g. 40 hours of work and 40 hours of volunteering to hit your 80-hour monthly target. Who is affected? The new mandate specifically targets able-bodied adults ages 19 to 64 who are part of the Medicaid expansion population, low-income adults who qualify under the Affordable Care Act expansion rules. State exemptions. This federal rule applies to the 41 states plus Washington, D.C. that have expanded Medicaid. If you live in a state that never expanded Medicaid, such as Texas, Florida, or South Carolina, this specific rule generally does not apply to you. Third, who is automatically exempt? Many Medicaid enrollees are legally protected from these requirements and do not have to report hours. Major exemptions include people under the age 19 or over the age 65 or older, individuals who are pregnant or within their 12-month postpartum period, individuals enrolled in Medicaid under a disability program, or those deemed medically frail, parents, guardians, and primary caretakers of children under the age of 14, or caregivers of a person with a disability, disabled veteran, current or former foster youth under the age of 26. 4. More frequently renewals are coming. Aside from tracking hours, the administrative process is getting a major overhaul. In many states, adults subject to the work requirements will have to renew their Medicaid eligibility every 6 months, instead of the traditional once-a-year schedule. Furthermore, when you apply or renew, states will use a look-back period of 1 to 3 months to verify that you were actively hitting your 80 hours before granting or expanding coverage. What you should do next. You do not need to scramble to report anything immediately. If you are affected, your state's Medicaid agency or health exchange is legally required to send you a formal notice by mail or email by September 2026. The most important step right now is to log into your state health portal and ensure your mailing address, phone number, and emails are completely up to date so you don't miss critical paperwork. For more content like this, subscribe to our Spotify channel and also follow us on YouTube. Or you can search in the Google search engine New York Podcast. Also, Adventurous Tours NY is teaming up with Global Digital Bimpy for Western African tours such as Nigeria, and also expanding to other African regions like Nairobi, Kenya. For more information on these tours, please contact them at bimpys2011 at gmail.com or Adventurous Tours NY at eventtoursny at gmail.com. Also, Adventurous Tours NY offer New York City tours. The main tours are Central Park, Grand Central, and Lower Manhattan. Again, this is Trevor, your host on New York Podcast. To the next story, have a great rest of your evening.